This segment is brought to you by Hoosen Mudderfontein Private Hospital.
Osteoarthritis is a common form of arthritis that affects millions of people worldwide. We are joined by Dr. Hoosen. Dr. Hoosen, thank you for joining us.
Thank you for having me on your show.
So let's firstly define or tell us more about what osteoarthritis is.
Osteoarthritis is generally a degenerative joint condition. What that means is that you have two bones that are next to each other, but the bones don't touch each other because covering the edge of the bone is a layer called cartilage. Cartilage on either side of the bone acts as a shock absorber. It takes the impact and it prevents friction between the bones. As you get older, the cartilage may wear away. When cartilage is worn away, the bones start rubbing against each other, and that is referred to as osteoarthritis.
What are some of the causes then?
So generally it's idiopathic, meaning we don't have a cause or a degeneration, wear and tear. As a person gets older, the cartilage gets worn away, and that may cause osteoarthritis. Other causes include trauma, some kind of trauma to the bone, in other words a fracture or break in the bone. The cartilage may get damaged, and that may lead to osteoarthritis later on in life. Or other conditions such as rheumatoid arthritis or gouty arthritis, where the cartilage of the bone is being affected, and that can lead to arthritis as well.
Are there early signs?
The early signs that one could have are pain in the joint, you could have swelling of the joint, and later signs, patients complaining they have stiffness, have difficulty with activities of daily living. When we mean activities of daily living, for example, a person may have a limited walking distance. Instead of walking the usual 1-2 kilometers, they say I can't walk as far as that, I'm probably walking only 100-200 meters and I'm getting pain in my knee or in my hip. They may also have difficulty climbing up and down stairs. They may have difficulty sitting in chairs. They prefer a high chair as opposed to a low chair because they have difficulty getting off the chair. They may have difficulty putting on their own socks and shoes. They may also have difficulty getting in and out of a bathtub because of the joint being painful or stiff. Other simple things such as getting in and out of the car, they may have difficulties with that. Patients who have the more severe forms of osteoarthritis, what we do find is they tend to sit in the front seat of the car, for example, because they can stretch out the leg as opposed to the back seat where it's too cramped and they can't manage long distances in the back seat of the car.
What are some of the treatments available to somebody suffering with osteoarthritis?
So osteoarthritis can be treated either conservatively or surgically. From a conservative point of view, we could start off with analgesia, which is your basic medication for pain. Thereafter, we could also prescribe a walking aid, such as a walking stick, to try and take the pressure off the joints. And then moving on, we could prescribe injections into the knee, which is like a steroid injection, which can help. The problem with osteoarthritis is that we don't have any specific medication that can reverse the process, or generally no medication that can form new cartilage. So the problem with this is that once you have osteoarthritis, the general tendency is for this to progress and to get worse. Once a patient has exhausted all conservative means, the pain has worsened, the activities of daily living have progressed to a stage where they're now struggling to do the daily activities, then the next step we could consider is surgical form of treatment. And a surgical form of treatment is generally a hip or a knee arthroplasty. That means a total hip or a total knee arthroplasty. Essentially what we're doing is the bone that is diseased, we take it out and we replace it and we put something else instead, a metal in the space of the bone. So for example, if I had to show you, this is an example of a total hip replacement. So this is the cup part to it, this is the plastic liner that we have, and this is the head, neck and the stem. So essentially if this was part of the hip replacement, what it would do is that will be part into the socket, this would be going into the femur, and this is what your hip replacement would look like here. Okay, and the idea of this here is to try and reduce the pain and give you better quality of life. And hip replacement, for example, has been known as the surgery of the century. Because it has been so successful, patients who have had a good hip replacement done, they have no pain thereafter or very minimal pain and lead good quality of life.
Doctor, what advice can you give to people who are currently suffering with osteoarthritis to improve their quality of living?
My suggestion is that if you're suffering with osteoarthritis, exhaust all conservative means, meaning the analgesia that I suggested, Also the injections if they're appropriate, using walking aids. If a patient is overweight, try and reduce their weight as well. If all of those measures have been exhausted and the patient is still experiencing severe pain or stiffness or limited activities of daily living, the next step would be either a hip or a knee replacement. And my suggestion is that try and find a surgeon who is doing this procedure regularly. Someone who is well clued up in a hip or knee arthroplasty or hip replacement, because the literature has shown that patients who have the hip or knee replacement done by a surgeon who does it regularly have better outcomes than someone who does it less frequently. At Hoosen, it is an orthopedic hip and knee replacement center. It's a center where we do these procedures on a weekly basis, and we have the vast experience in doing these kind of procedures.
Well, thank you so much for joining us today.
Thank you.
Hoosen Modderfontein Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Hoosen Modderfontein Private Hospital offers their patients and their visitors the ultimate Hoosen experience. Premium care, personal touch.